SNMMI 2022 annual meeting is well underway and once again has provided physicians, technologists, pharmacists, laboratory professionals, and scientists with an in-depth view of the latest research and development in nuclear medicine and molecular imaging. SNMMI TV starts right now.
Hello everyone and welcome back to SNMMI TV. My name is Gina Phillips and I'm here to share all the latest at this year's annual meeting with you. Stay tuned as we'll be having one-on-one conversations with leaders in the field and highlighting organizations that are at the forefront of nuclear medicine and molecular imaging. But first, let's take a deep dive into artificial intelligence. We'll look at how it's being used in image processing and predictions. Then we'll learn about opportunities for the use of AI in molecular imaging.
We're in this new era of AI-powered image processing. AI has pervaded all branches of image processing, including image recognition, image restoration, and enhancement. In addition to influencing image generation, we're using AI increasingly for predictive analytics on images. AI has tremendous potential to transform healthcare, particularly radiology. In the specific context of molecular imaging, I'd say AI is really improving image quantitation. We are seeing images that are AI generated that have enhanced resolution and reduced noise. We're also seeing a lot of potential for AI-assisted clinical decision making, including new tools for diagnostics, therapeutic outcome evaluation, and theranostics. So this is a very interesting session with a fabulous lineup of talks covering a whole bunch of different emerging topics that highlight applications of AI in nuclear medicine. We'll see a variety of different talks, for instance, that cover radiomics, new hybrid machine learning approaches for radiomics as applied to Parkinson's disease. There'll be talks on AI methods for attenuation correction in both PET and SPECT. We're also going to look at new approaches for AI-based image denoising and even kinetic modeling for dynamic PET. In terms of takeaways, I would say the session sort of highlights the sheer breadth of applications where AI is really making a difference in nuclear medicine. In addition, there is also this focus on methodological advances. We are seeing a lot of increased emphasis on techniques that rely on self-supervised and unsupervised AI approaches, and also on hybrid approaches that not only rely on data, but also on physics.
So we're students from BCIT, so it's our first year. We started out learning a lot about it in school, so we have a class dedicated to all of the different radiopharmaceuticals and how they work, and then they take that learning and knowledge and put it in an applicable setting. So we get sent out to different hospitals and get to work with different technologists and get to learn all their techniques on how to use it.
With our training, our school actually sends us out to different locations, and in those locations we're being trained by various different technologists. So they all have different techniques and they all have different ways that they like give patient explanations and even like set up patients. So I think it's really important that we learn the various different ways so that when we're actually out there and we're injecting and we're like working with patients, we have like a variety of knowledge of how to do that.
I come from University of Southern California, USC. I already working for that for more than 10 years. And my lab focuses on development of molecular imaging probes for cancer and also other diseases. And in my lab, I do have the poster and a graduate student and also other students. And it's my great pleasure to work with them together to get our project done, and especially some novel imaging probe we're already developing in our lab and can be used for preclinical research and also for clinical studies.
At my site, I work at a private cardiology practice. We do the traditional SPECT imaging imaging for myocardial perfusion. But in the interest in other facilities where they're looking to expand their nuclear cardiology practice, I would strongly encourage them to use the SNMMI website resources, the current SNMMI articles, references, attend the nuclear medicine meetings. There's always categorical sessions that are being presented at every annual meeting, and then throughout the year there'll be different cardiac imaging centers that are going to have lectures and stuff on being able to expand your practice.
I am joined now by two very special guests, Dimitri Bader and Dusty York. Thank you so much for joining me today. So, Dusty, I think I'll start with you. I want to talk about the workforce pipeline for technologists. What is it like right now? Take us through it.
So this is a difficult time for us. We have developed the Workforce Pipeline Task Force to look at this issue. So we are looking at a potential significant shortage of technologists moving forward. At this time, we have several issues that are taking place, which is creating essentially the perfect storm. We have a large majority of our technologists are an aging population. About 50% are over the age of 50. So we're looking at a significant number of retirees in the next 10 to 15 years. And in conjunction with that, a decrease in the number of nuclear medicine technology programs to train these technologists. A decrease in the number of technologists becoming certified due to the decrease in the number of programs. So we're trying to get ahead of this with this Workforce Pipeline Task Force to take a look at all the issues.
Well, I'm sure COVID has also had an effect. Dimitri, do you want to comment on that?
Yeah, so unfortunately COVID has had a large effect on us. So what we saw in the first 6 months or so is many people worried about safety, changing the way that they're working. We also saw some people that were getting laid off because of COVID and the loss of volume in nuclear medicine and PET. And so what we saw over the first couple of years is that, over the last couple of years, sorry, was the fact that people were getting out of the field and either retiring altogether or switching to a different part of healthcare. And so that has contributed to the problem that Dusty is talking about, where the fact is we started losing nuclear medicine technologists sooner than we thought we were going to lose them. And so what we're seeing is this is a good time for nuclear medicine and molecular imaging. Our field is growing, our volume and our demand is going up, but now we're having trouble having staff, just like on the physician side, having staff to be able to do the studies that we need to do.
How are new therapies having an effect on this?
So I'll take Dusty's words here, perfect storm. So what you're seeing is that the new therapies, some of the theranostics work that we're doing, both on neuroendocrine tumors, on prostate, and then there's some emerging technologies and emerging therapies that are coming down the pike. So we're probably going to see, just over the next 3 to 5 years, our therapy volume in nuclear medicine going up 300, 400%. And so that's amazing. Now, when we look at some of the data that we were able to find, you're seeing about a 30% decrease in the amount of technologists that we're going to have. And so what we're right now projecting is that by the end of this 2020 decade, we may have a 30% shortfall in technologists.
Wow.
So emerging technologies are going to be great because they're going to help our field grow. But some of the emerging technologies out there, like artificial intelligence, like machine learning, some automation, we're going to need that help. That's going to help us be more efficient so that we can properly move our technologists to different areas throughout the delivery of care.
So what can SNMMI do about this?
So that's why the task force was developed. We are really trying to collect data at this time to figure out really what that true shortfall is going to be and to come up with a strategic plan in how to attack this. So we are identifying issues right now with the program numbers going down, with therapies coming up, also to be able to train our new technologists in these new therapeutic procedures. So we have a lot of things in the pipeline, but we're really trying to collect the data at this point to support that information.
So you can go about it in the right way.
Absolutely.
Yeah, well, thank you for breaking it all down for me. Tromsø's Pet Imaging Center is one of the most modern pet centers in the world. Founded in the far north of Norway in 2018, it hosts the very latest in clinical scanners, including PET MR. At the same time, the center is also conducting state-of-the-art research in its preclinical facility. This includes PET, CT, SPECT, MR, and an external X-ray irradiator, one of the very few in Europe.
We in Tromsø can do research from basic organic chemistry all the way to research in human beings.
Dynamic PET allowed us to quantify the amount of radioactivity that we find in different organs.
We can track immune cells in vivo in response to therapy.
We aim for treat and image brain tumors at the same time.
We are working with a true theranostic pair, copper-64, copper-67.
Whether it's low back pain, headache, or myofascial pain syndrome, collectively cost the U.S. more than $500 billion annually. And yet our current imaging methods to correctly identify pain generators remain inaccurate. Let's see what the Department of Radiology at Stanford is doing about it.
The mission of the Biswal Lab for pain imaging at Stanford University is to help those suffering from pain. This is the most prevalent disease now on Earth, and I just feel we need to do a better job.
Our imaging is unique because we do not really depend on the findings from the structural imaging. We do offer the structural findings, but we augment that by offering molecular imaging evidence, which is coming from experimenting with this new molecular tracers.
So this imaging allows us to drill down. Here's where the problem is. This is where it's active. This is where it's hurt. And then we are able to focus our intervention to hopefully treat what's causing the pain.
We're bringing in a new era of medicine, and I'm hopeful using this technology to better diagnose patients suffering from pain.
There's a potential for this to completely change the way that we treat pain these days.
The Biograph Vision Quadra builds on the state-of-the-art SIPM scanner and extends the field of view to dynamically see from vertex to thighs to deepen your investigations. The Biograph Vision Quadra is 40 times more sensitive than conventional PET-CT scanners and 10 times more sensitive than the state-of-the-art SIPM scanners on the market today.
I think with the whole body PET-CT system which we have now, we are just super flexible clinically. With regard to the radioactivity which we administer to the patient, or with the acquisition time which we apply also to the patient. And this, as I said, makes us very, very flexible. And we can, for instance, in certain patient cohorts go down dramatically with activity which we administer, for instance, in children or young patients, non-oncological patients, or on the other hand side, in the not so compliant patient, we can also decrease the acquisition time to make in general the burden to the patient as low as possible.
What I want to review today is a patient that was acquired from our customer site out of Bern, Switzerland. What is truly remarkable is you can get an image from the top of the head down to mid-thigh in one field of view, which is 106 centimeter. We've never been able to do this before. So to acquire a patient within 10 minutes to get this quality of image is truly remarkable. Why this is important is if a patient has metastatic disease and needs to get up because of pain management, then you can stop the image and get the patient up, but still make a clinical diagnosis from your scan. And to get the level of detail within the vertebra, within the pelvic activity into the bone marrow and then see the vascular detail is truly remarkable with the less than 4 millimeter spatial resolution.
From a research point of view, I would say that especially dynamic imaging is an interesting topic and becomes much easier now to be performed with such a scanner. And the other interesting thing I think is also the low dose or ultra low dose approaches, which become possible now if you have an ultimate goal maybe to have a radiation burden compared to a transatlantic flight. I think this is an interesting aim to follow. In total, the power and the performance of the system is really amazing, and this made us very excited about the system.
The Biograph Quadra can address the challenges for customers who really want to do research in a routine manner. The Biograph Quadra really enables you to do efficient and effective clinical workflows and throughput so that you can delegate and give time to researchers to use the system during normal working hours. And that's one of the biggest benefits that this scanner meets. Additionally, the other one is room size. So we wanted to make sure that we could address that, and we addressed that by making a scanner that fits in a traditional PET-CT scan room. So it's a very practical scanner for both the clinical and the research to enable that moving PET forward.
At this year's SNMMI, we're super excited to pioneer another breakthrough in healthcare with the introduction of our new Symbia Prospecta SPEC-CT. The Symbia Prospecta SPEC-CT has been designed with the user in mind, and it will set a new performance standard for SPEC-CTs. It also has a lot of advanced SPEC-CT features, such as automated motion correction, automated respiratory correction, automated retrospective gating, and also continuous scanning mode, which allows you to reduce scan time and increase image quality at the same time.
With Symbia Prospecta, on top of the innovations that we have on the SPEC and CT, we are also introducing a new intuitive user interface that fully integrates SPEC and CT into a single user interface. We're also integrating My Exam Companion, and with that, we deliver an intelligent imaging experience by automating steps or providing guidance that helps our users to navigate across the entire SPEC-CT imaging workflow. One great example about how we are automating steps is Click and Go, our one-click startup shutdown solution. Our users will be able to literally turn on the system in less than 5 minutes by just clicking one button.
One of the major advantages of the Symbia Prospecta is the ability to deliver really high-quality CT with thin slices. And along with that, we have also metal artifact reduction capability. So you can see an example of a patient with a right-sided total knee arthroplasty prosthesis who has pain. And we can really image with the expect bone showing a small focal hypermetabolism. But when we look at the CT, with the metal artery reduction, it becomes really useful in terms of defining the exact position and localization and also characterize the lesion. So this is where really the advantage of the Symbia Prospecta for orthopedic imaging goes in, and this advantage also translates to many other broader indications, both in oncology and in other areas like general imaging with lung imaging, etc.
Siemens Healthineers is committed to understanding our customer needs and developing pioneering technologies that improve healthcare for everyone, everywhere.
Now I'm joined by Sharmila Durbala. Thank you so much for sitting down with me today. And now I want to talk about some of the goals for nuclear cardiology imaging. Take me through it.
Thank you, Gina. Really excited to be here. So the field of nuclear cardiology imaging has really exploded over the last several years. We have many novel tracers and developments. There have been a lot of exciting developments in quantifying myocardial blood flow using positron emission tomography imaging. And there's also been an explosion of work and literature in imaging cardiac amyloidosis. On top of that, as you heard at last year's meeting, we have many other molecular tracers in the pipeline. So the future is looking really bright for the field.
Oh my gosh, it really does. Okay. What are some of the highlights sort of overall that you're thinking about, that you're excited about?
Yeah, this particular meeting I'm really excited about because we received 40% more scientific abstract submissions compared to last year. So this is very exciting. Then on top of that, the topics, some of the topics that we have seen research coming out of are very exciting. So if I look back and look at my research on all the scientific submissions from this meeting, the topic that stands out most is called fibroblast activating protein inhibitor imaging. So this is
Is there an acronym for that, or?
There is. It's called FAPI. So gallium-68 FAPI. This is a novel radio tracer that's been developed to image tumors and the extracellular matrix of the tumors. So since last year, we've seen publications on using this for cardiovascular applications. And if I were to say one topic that stands out for me at this meeting, it's FAPI imaging of cardiovascular disease. So you have post-MI applications, applications in animal models, hypertrophic cardiomyopathy, in patients with non-obstructive coronary plaque, and even in amyloidosis.
Wow, fascinating. Well, I won't use up too much more of your time because you've got to get out there and meet all your colleagues and take in more sessions. Thank you so much.
Thank you so much, Gina. Thank you. Bye.
I am joined now by Johanna Diekmann. Thank you so much for sitting down with me today.
Yes, it's a pleasure. Hi.
Well, we're discussing something very exciting. You are an award winner, Image of the Year. What does that mean? Take me through it.
Yes, I mean, first of all, congrats. And we are very, very proud and happy to receive this award. And also would like to thank the scientific committee for considering our abstract for this important award. And yeah, the whole Hanover team is really excited about that.
Oh, congratulations.
Yeah, thank you.
When did you find out?
I think it was 2 or 3 weeks ago.
Okay.
Yeah. So I knew a little bit beforehand, and yeah, but I had to keep it a secret.
Of course, I know. Even now people don't know. We're kind of
that's true.
it.
Yeah. No, I'm very happy about it. It's a great honor.
So tell me about the award and the image itself.
Yeah. So this year we have a cardiology image, which is kind of, new maybe. It wasn't a cardiology image for the last couple of years, so we are proud of that also. And what we did is we looked at cardiac healing processes after an injury, so after an acute myocardial infarction. And we studied patients who were admitted to our hospital in Hanover and underwent revascularization therapy there. And we wanted to look at the complex cellular processes that are induced after that by using the molecular imaging. And there are these new FAPI tracers. These are specifically visualizing activated fibroblasts. And these are cells that are very important for various healing processes throughout the whole body and also in the heart. And so what we did is that we looked at the heart with the FAPI tracer and found a high specific uptake in the infarct area, but also in the surrounding heart. And these tracers were primarily designed for oncologic imaging from our colleagues in Heidelberg, also in Germany. And they also kindly gave us a precursor for that, and also their thanks to them. And it worked out very well, and we see a good uptake also in the heart with this specific new tracer. And maybe important, the specific molecular target where these tracers are binding is the fibroblast activation protein. This is protein on the cell surface of these activated fibroblasts. Yeah, and this had a really high and specific uptake in the myocardium.
So what are we seeing specifically in the image?
Yeah, so we have here a patient example of our patient cohort, and this patient had an anterior wall myocardial infarction. As you can see in the top row, this is the myocardial perfusion spec, a standard examination for perfusion imaging. And we see a matching area of injury in the cardiac MRI. And then we see in the middle row the FAPI uptake, and this is by far exceeding the core infarct zone. And this means that we think there's not only fibrosis in the reparative fibrosis, but also interstitial fibrosis in the surrounding tissue. And this you can see very nicely in our exemplary image.
And why is that significant to capture that part of it?
Yeah. After acute myocardial infarction, the cascade of repair is induced. And in some patients, we also see, besides there is a good acute treatment with a revascularization and also a highly standardized treatment for the heart attacks, but these early cellular changes that occur or reparative processes, these are undertreated. And it would be good to have some kind of easy accessible tool or predictor to see which of these patients will undergo something that we call adverse cardiac remodeling. That means which patients and why will have a heart failure after heart attack several years later maybe. And what we found is that the amount of, or the volume of the myocardial FAB signal we measured there had a significant inverse correlation with the later function of the heart. This means maybe we have some kind of new predictive imaging here and could be able maybe to identify patients early that will later suffer from ventricular dysfunction.
Wow. Oh my gosh. How does it feel to have found that and be able to tell others in your field?
I mean, it's really exciting. Also for me, it's the first greater award to receive here, and I think this is something really essential and new, and also it could change a lot of things in the field of cardiac nuclear medicine and give new fields where we could use, for example, fibrosis PET or cardiac imaging in general, for example, in order to select patients suitable for new therapies. That's very exciting.
Wow. Well, you're doing very important work. Thank you so much for sharing it with me today. All the best to you.
Thank you.
And congrats.
Thanks a lot.
Well, that's it for us here at SNMMI, but we hope you've enjoyed all of our exclusive content at this year's meeting. We look forward to seeing you next year in Chicago.